Hello everyone, my name is Nana. I'm a student nurse practitioner at the University of Michigan in Flint. Today, my classmate and I will talk to you about a very interesting subject, which is e-cigarette. Using e-cigarette is sometimes called vaping. Now, I know some of you know about it, some of you don't, so let's dig into the subject. What are e-cigarettes? They are small devices that come in many different shapes. Some of them are made of to look like regular cigarette, pens, USB stick, or things. As you can see on your right side, on the right side of this slide. Now those devices, they have battery that heat up liquid and produce aerosol. Aerosol is a substance enclosed under pressure and is able to be released as a fine spray. What are some of the names of e-cigarette? E-hookah, e-juice, vape juice, vape pen, tank system, and other names. Now, I don't mean to scare you, but this slide shows the effects of defective batteries of e-cigarette causing fires and explosion. I want you to stick around until the end of this video to know more about e-cigarette.
Do you know classmates that use e-cigarettes? Do you think it doesn't happen in your school? The truth is that in the United States, more than 3.6 million teens use e-cigarettes. That is 1 in 5 high school students and 1 in 20 middle school students. This is related to advertisements on TV, movies, social media that display a cool image and offer candy flavored liquids that are more appealing to teens. Here's one of our first questions, just so we can kind of get an idea of what information you know before we go further into this PowerPoint. Are e-cigarettes harmful? What are your thoughts? What do you guys know? The answer is yes. The liquid for e-cigarettes come in many different flavors, but the majority contain nicotine, along with additional substances that are harmful. Down below, you will see a picture of a woman with smoke coming out of her mouth. The first substance that we have is the nicotine, which we know is highly addictive and can cause cancer. The next one is the volatile organic compounds. These are chemicals that can cause irritation to the eyes, nose, and throat, can cause difficulty in breathing, along with nausea, and it can also damage your central nervous system, as well as other organs. These are also known to be cancer-causing. The ultrafine particles can lead into the lungs, which can cause irritations, and then eventually damage the lung tissue with more chronic illnesses. Here we have a little bit of popcorn because we found that with e-cigarettes, people can go ahead and have something called popcorn lungs. And you'll see in the next couple of slides a picture of it. Basically, it's where it's a serious lung disease and people can die from this because there's so much damage done to the lungs. There's also heavy metals such as nickel, tin, and lead that are involved in these e-cigarettes. And then finally, what we know from all e-cigarettes, anything with nicotine, that it is cancer causing.
In this slide, we'll be talking about facts of e-cigarettes and what the evidence actually says. In the last 5 years, the usage of e-cigarettes has increased by 80% from previous years, while the use of traditional cigarettes has decreased in ages 12 to 17 years old. Manufacturers are gearing the use of e-cigarettes to the ages 12 to 17 by using attractive flavors such as chocolate, cotton candy, bubblegum, and other fruit flavors. They are also making the e-cigarettes themselves look attractive. They're slim, easy to use, discreet. Nobody will know that you're using it. And lastly, the selling of e-cigarette products is low and very affordable. In this slide, we'll be talking about the pros of e-cigarettes or vaping from the standpoint of adolescents or teens, what they believe could possibly be the pros of e-cigarettes. Some teens might think that it might help them lose weight and or help them to relieve stress. Many of them might smoke because they think it's cool. Many of them might think it's easier to use an e-cigarette as opposed to an actual cigarette because it's easier to hide. They might be able to think, oh, I can just take a few puffs in between classes and nobody will ever know. And another pro might be that even though they're smoking an e-cigarette, they won't smell like nicotine as if they smoked a traditional cigarette. Listed below are the cons of using e-cigarettes in actuality. For one, it's very addictive. As we know, e-cigarettes have a small amount of nicotine in them, which make them addictive. Chronic e-cigarette use or vaping can change the lung tissue. Listed below, I have a picture of what the normal lung would look like, as well as what popcorn lung is. Popcorn lung, as you look at the bronchioles, which is towards the right of the right lung, those are abnormal in size and can cause irreversible scarring of the bronchioles, which is a smaller portion of the lung. There's no cure for this. This is dangerous because if a patient or a student gets intubated, which means they have to put a breathing tube in their throat for a procedure, it could be a simple procedure such as getting your tonsils removed or something like that. Having popcorn lung makes it very difficult for intubation, and it has been known for young, healthy individuals that use e-cigarettes that have popcorn lung have unfortunately died from it. Another kind of using e-cigarettes is that they might be able to deliver cannabis, which is marijuana or weed, whichever you want to call it. The use of cannabis can possibly lead to the use of other recreational drugs or illicit drugs such as heroin, cocaine, just to name a few.
Misconception number 1. E-cigarettes are just flavored water vapor. This is not true. The aerosol produced by e-cigarettes is not just water vapor. E-cigarettes are often a mixture of harmful chemicals. These chemicals can cause cancer and irreversible lung damage. E-cigarettes produce an aerosol that pollutes the air, and the aerosol is a mixture of nicotine, tiny particles of metal, and some of the same harmful toxic chemicals found in secondhand smoke. Misconception number 2 is that e-cigarettes don't contain nicotine. This is untrue. Electronic cigarettes actually usually contain nicotine, and nicotine is a very addictive substance. 1 Juul pod alone contains enough nicotine to equal 20 conventional cigarettes, as we can see by this picture over here, 1 Juul pod equaling 1 cigarette pack, which is a lot of nicotine. Nicotine use has been linked to memory loss, which is very detrimental since the brain keeps developing until the early to mid-20s. So this is a really good slide here. It's just going over the changes that e-cigarettes can cause on the brain because of the nicotine content in e-cigarettes. These changes include addictive behaviors. You may become more anxious or irritable. You can have problems with impulse control, and you may even potentially develop attention deficit disorders or have memory loss. This video on the right was made by Tobacco Free California, and it's a great video that shows the effects of nicotine on the teen brain. Misconception number 3 is that e-cigarettes are safer than conventional cigarettes. This is not true. Cancer-causing agents and irritants that are found in conventional cigarettes have also been found in e-cigarettes. And e-cigarettes have been shown to negatively impact the lungs and the heart, just like conventional cigarettes do. So overall, e-cigarettes are just as bad as conventional cigarettes, and this is a myth.
Misconception number 4. E-cigarettes have no gateway effect. E-cigarette use is associated with a greater risk for cigarette smoking. Some people think that smoking e-cigarettes or vaping is better than the alternative to smoking tobacco cigarettes. This is not true. Many vaping devices can also be used to inhale marijuana. Marijuana can cause memory loss, decreased attention span, and learning disabilities. So therefore, e-cigarettes are still not good.
When you go to your doctor's office or primary care practice, there are many things that they are doing to help educate you on the dangers of e-cigarette use, vaping, and smokeless tobacco. Some of those things are checking in with you to see how you're doing at every visit when we take your blood pressure and your heart rate. We can also set you up with a texting app on your phone to help you get the support you need and the help you need to quit smoking or learn about the dangers of smoking. A couple of those are here for you. You can text the word quit to 47848, and they'll send you 3 to 5 text messages a day to help. Also, there's people called office champions who are just helpers at the office. That could be nurses or the doctors or medical assistants that will keep in contact with you after your visits for any questions you may have about smoking, about the dangers, what is out there to help you. And your provider can also help you talk to your parents as well to break the news to them that you have started smoking or that you're ready to quit.
This is just a quick 3-question quiz. And we want to thank you so much for watching this. Feel free to pass this video on to your friends.